Today I'm at the Cosmetic Skin Clinic in Buckinghamshire, where I'm going to be interviewing Dr. Tracy Mountford, talking to her about the instant facelift. Hi Tracy, it's fantastic to meet you. Tell me about the instant facelift. Is it possible to have a facelift without surgery?
It is absolutely possible to have a facelift without surgery. Commonly, and you'll see it later when I perform it, a wire lift is performed, which just simply involves injecting facial fillers across the cheekbone area, down the nose to mouth lines, and in the lines that go from the sides of the mouth to the jawline to give a bit of a hitch-up effect to the face. And nowadays as well, commonly radiofrequency treatments like thermage are used to remodel and tighten collagen at deep level, and that's a very impressive result as well.
So, are these treatments suitable for anyone of any age?
Generally speaking, yes. However, better results are achieved in the younger age categories. So, for example, women in their 40s or even 50s will tend to get more impressive results than people in their 60s. So there is a preference for age and when you start these treatments.
Are there any developments in the anti-aging arena that really excite you at the moment?
Again, radiofrequency treatments are really very exciting because they're moving on, they're getting better and better, and so much more is being achieved with them. So that is one area that's very, very exciting. The other area is pixelated laser, because there isn't the downtime nowadays with laser that there was in the past. So you can retexturize skin with very little downtime and great results.
And again, suitable for all ages and all skin types.
Yes, that's true. The best skin types are the fairer skin types, but nonetheless you can treat any age category. There's no doubt though that the 40s and 50s are perhaps the best age category to treat because they'll heal quicker, they'll respond quicker, and the results will be even more spectacular.
So now, is it possible to have intervention and avoid ending up looking like a bit of a cosmetic freak? Because I think that's the biggest fear on everyone's mind.
Yes, that is possible. The trend nowadays is for less is more. We shouldn't be over injecting people or making people look like startled rabbits. So the trend now is for baby Botox.
Not on babies.
Not on babies. That's literally a very, very light, soft dose of Botox just to give a soft airbrush effect. And just to literally just be very appropriate in treatment for the age of the person. So what we would do for a 40-year-old woman, we wouldn't necessarily do for a 60-year-old woman.
So in your mind, when is it an appropriate time or age to start considering cosmetic intervention?
People vary enormously. I see some women in their very early 30s who already have established lines. I see other women in their mid-40s who look much better. Their skin quality is so much better, and that's to do with genetics, lifestyle, numerous factors. So there's no absolute answer to that. It's literally assessing someone properly and guiding them appropriately. But if you're homing me on an age category, I'd say probably mid to late 30s.
Is there one type of cream out there that you think everyone should be using?
Nowadays, probably vitamin C serums that penetrate the skin. Certainly the high quality cosmeceutical vitamin C serums do improve skin elasticity, and you can actually see this over a 3, 4, 5 month period, the skin quality getting smoother and fresher and tighter. So the thing that would be in my beauty bag would be vitamin C serum.
And in your mind, what is the most cost-effective anti-aging treatment out there in terms of price and pound for pound effectiveness?
Facial fillers like Restylane. A syringe of Restylane in the nose to mouth lines would be very good value for money because it would soften the nose to mouth lines. It would last probably 6 to 9 months easily, and with top-ups at that time probably eventually last a year plus. So I think that would be the most cost-effective treatment available.
And how far would one syringe go?
Depends how old you are and what result you wanted. Certainly to soften the nose to mouth lines in, say, a 30 to 40-year-old woman, one syringe probably is enough. As you get older and the lines become deeper, maybe someone would need to go up to 2 syringes, so it would cost them obviously more. But nonetheless, the top-up treatments would then only be about 1 syringe, so I think that's very good value for money when you consider that's about £350, lasting you about 9 months plus.
That's fantastic. Thank you so much for your time, Tracy.
Thank you very much, Nikki.